Over the past several days, the Omicron variant has seemingly been spreading like wildfire across the country. Health authorities on Monday reported a whopping 284 new infections, followed by an additional 485 on Tuesday. During Wednesday's COVID-19 update, Health Minister Dr. Frank Anthony confirmed that 788 persons have been added to the list of COVID-19 positive persons in the country.
And this came from 1,878 tests. So the positivity rate has gone up, so it's about 41.95%. And that shows that we have a lot of people getting positive very quickly. We also had 2 deaths over the last 24 hours, and that too we are monitoring.
Despite the rapid spread of this highly contagious variant, health officials have not made any attempt to suppress new infections by activating border closures. It is the view of Health Minister that closing the borders will not stop the circulation of the variants, but could slow it down. The ministry is now relying on vaccines for protection against a new variant, with approximately 20% of the adult population still to receive first doses and over 40% to become fully immunized. With limited data still available nearly 2 months since the Omicron variant was first identified in South Africa, it is being labeled as the second most contagious virus on the planet, behind measles. It has more than 50 mutations with over 30 in the spike protein, enhancing the virus's ability to infect the body. Nonetheless, the World Health Organization has outlined new evidence which suggests Omicron causes milder illness and does not affect the lungs. But even as efforts are being channeled to conquer the Omicron variant, another strain, IHU, has emerged in France. IHU has 46 mutations, 4 less than that of the Omicron variant, and has so far infected hundreds of people in France. The first case was reportedly linked to a person with a travel history to Cameroon, Western Africa. IHU was also identified in November 2021. Dr. Anthony provided further insights into the new variant.
There are about 15 amino acid changes. Some of it would be deletions, some of it would be mutations. And therefore, they're still investigating to see what would be the effect of this. Right now, in the part of France where they've discovered it, initially there were 12 patients. Now they estimate that they have close to 955 patients, I think. And they are also seeing in that region a higher amount of hospitalization.
Meanwhile, active COVID-19 cases in Ghana stand at 2,554. 59 patients are hospitalized and 5 in the COVID-19 intensive care unit.
We now have 1,648 active cases in Region 4. Region 6, there are now 338 active cases. And in Region 3, we have 206 active cases.
Temika Rodney reporting for the HGP Nightly News.